Hi, good afternoon. My name is Jennifer Reed. This is my University Hospital Action Plan for my Leader 620 class for Grand Canyon University. I first wanted to review our mission statement to promote the good health of the community by providing the highest quality of care to both inpatients and outpatients, by teaching the next generation of health professionals, and by supporting research, thereby advancing medical knowledge and improving the delivery of patient care. And also our vision statement, which I did modify a bit. I'm not sure about the rules of posting our actual name and area. So our vision statement is: we will continually improve the health and well-being of the people of the area and beyond. I first identified my stakeholders, and they include financial, customer, internal business processes, and learning and growth. First, for our financial stakeholder, I'd like to control spending by reducing waste. I'd like to educate staff on the importance of waste reduction with mandatory waste reduction education classes, and a review of need versus want when choosing equipment for specific procedures and day-to-day care. I'd like to have unit-based committees formatted to encourage further involvement and to help hold brainstorming meetings to evaluate specific waste unit by unit and plans to address them. This will enable each unit to support each other and consequently lower spending for the entire facility. I'd also like to reduce overhead by offering more outpatient services. I'd like to compile data to support procedures that routinely require little recovery time and determine which can be performed as an outpatient procedure. To determine which can be performed on this basis, we'll have nursing and physicians review short procedures that have a recovery time of 24 hours or less. This will reduce overnight admission. We'll then develop a criteria for the patients that would be the best choices for the selected procedures and conduct a trial of 2 months to include pain management, medication, activity, and follow-up. The results will then be evaluated by staff and administration to include finance and to determine the amount of funds saved, if any. Our next stakeholder is customer. I'd like to provide excellent care and maintain safety and improve outcomes. First, we'll review safety incidents and improvement in outcomes such as readmission and infection rates. We'll then provide each unit the results of the data collection and have them displayed and visible through staff through a dashboard. We'll determine methods used by areas that have the best scores and use them as an example for others. We'll also discuss the areas that each unit has scored well in and what methods were used to achieve this. We'll provide training sessions and education with staff from successful areas to share their methods with others. Successful methods will be posted to the quality page on the intranet to share with other units. I'd like to improve our image to attract more customers. I'd like to focus on our expert staff and our excellent record related to patient care and services through advertising such as television, social media. Our newer, more modern facility and improvements that have been made must also be shared with the public. And I'd like to institute what I would like to call Got Caught Caring, and this would be announced to staff and directors, and staff will be filmed performing their daily activities with smiles and happy, satisfied customers, with permission, of course. These will include staff and all staff, such as nursing, physical therapy, even maintenance, housekeeping, and food service workers, and will imply that filming could occur anytime, anywhere. This will keep all staff aware of their appearance, performance, and the importance of a positive attitude. We'll ensure news coverage for our volunteer services at public events, family activities, and health fairs. We'll have customers interviewed on the spot as well as scheduled to testify about the care and attention that all staff at our facility gives. Our new facility and the renovations and other improvements and updates that are also taking place will be showcased by various staff in many guided tours. All footage with recognition of participating staff will be featured on our intranet and home pages to foster a sense of pride in our facility and each other, and also cultivate a desire to become more involved in future events. Internal business processes. I'd like to improve Press Ganey scores for overall patient satisfaction. We'll gather appropriate data to determine specific areas that need to be addressed. We'll plan small meetings with staff to determine the fallout and how to improve scores. A quality committee representative will meet with staff representatives from each unit. They will then form their own subcommittee or task force for satisfaction improvement. Each unit will perform data collection to determine areas of improvement and will plan their own unique approach to improve satisfaction scores, and a representative will present this data and plans. Representatives from each shift will be rotated to increase participation, and areas with most improved scores will be recognized and their methods assessed for potential use elsewhere as applicable. I'd like to decrease the number of catheter-associated infections by 25% by the next quarter. Staff teaching staff is my main plan here. One-on-one review instead of group review to avoid embarrassment as needed. We'll have staff make suggestions on improvement methods, and we'll reward the most improved units. Volunteers would be recruited to review technique for all staff and on a one-to-one basis as stated if needed. Staff will track and follow their own units to address any issues that arise, and units will also be tracked through random chart audits through the quality department. Learning and growth. I'd like to ensure appropriate education for all staff. Okay, sorry. Well, to improve reimbursement programs to include higher qualifying education and training, and to offer incentives such as bonuses or pay time off hour accruement for higher educational pursuits. We'll provide a link for information for in-house opportunities for training on our intranet homepage, and we'll also provide information on our online learning page for training that includes all patient care staff and continuing education hours that can be earned. Invite all staff via email to participate in any upcoming events that is applicable to them. I'd also like to offer more and varied education opportunities. Most education and training are nursing focused, with nursing contact hours offered. However, there are many other specialties that are directly involved in patient care and outcomes. We should develop education and training opportunities for these: physical therapy, occupational therapy, EEG, radiology, and provide appropriate contact hours that are approved by their licensure boards. We should also develop programs for all participants, for all staff to participate where it's appropriate, such as infection prevention, ethics, and safety. I believe that if we employ this action plan, we'll improve our customer satisfaction, our finances, and improve learning and growth among our staff, and also improve our overall appearance to the public. If there are any questions, feel free to ask. Thank you.